Joining me in the studio is Jeremy Daly. He is a physician assistant at Tripp Family Medicine here in Twin Falls. We're at 8:34, and it's 38 on Magic Valley this morning too, as well. But we call it Better Health with Tripp Family Medicine. Jeremy, let's just start off on that too, because Tripp Family Medicine has been a growing practice, and a lot of people who are new to town are looking for somebody, a medical provider, because a lot of people who relocate here, it's a long drive sometimes to see their previous doctor. And so if they were looking for the office, how do they find it?
Well, I would say, one of the first things is we like people to get to know who we are. So we have a website. It's trippfamilymedicine.com. So come get to know us, the providers there, and our staff, and just kind of the way that we operate as a practice. Our office is located across from the post office on Fillmore, 1411 Fillmore, and we also have a lot of other presence as far as social media presence on Facebook, and so we keep things up to date as far as things that we're doing. Like today, we have a peel party going on this afternoon. So for those who don't know about that, that's a chemical peel, kind of a cosmetic side of our practice. So we do that. We do a wide variety of family medicine, urgent care, and cosmetics. So
I was going to say, is this class or this party that rather is that full today?
it was almost full, and so we had a few people that had dropped out last minute. So there are some spots available. So if you want to get a hold of our office at 933-4400 and set something up for later this afternoon, that would be great.
We're talking today about something called aspirin therapy, and you got me on this one. I do a lot of reading. I hear a lot of medical terms. Don't know what aspirin therapy is.
Yeah, so we talk about aspirin a lot, and I have a lot of patients that come into the office saying, "Hey, I'm taking aspirin," and it's part of their medication list when they come in. So we have the conversation. Why are you taking that aspirin? What's the purpose of taking that aspirin? So a lot of people, they'll say, "Well, I just want to stay healthy, so I'm taking an aspirin," and don't really know what it does and why they would be taking it. And some people have an idea. They've heard that it maybe will help them cardiovascularly as far as preventing things like strokes and heart attacks. And there's that's one of the topics I wanted to cover today. Is we do use aspirin quite a bit, and it is an important part of preventative medicine, that aspirin therapy is, but it's not meant for everyone, and there are risks associated with taking aspirin.
A lot of these risks we didn't really know about till just a few decades ago.
Right. Yeah. I mean, as far as the major things that we talk about, anytime you're taking aspirin, it really what it does, uh, it's a platelet inhibitor. So platelets are the cells in your body that form clots. So the first part of clotting is this platelet plug formation that happens, and then there's all sorts of other clotting factors that come together and stop bleeding from happening. But when you take an aspirin, it prevents that that first part of the clotting pathway from happening, the platelet plug formation, and so you bleed more. So that's good if you're trying to prevent a blood clot that would cause something like a stroke
Hmm.
or a heart attack. That's great. But it also causes bleeding. So if you take aspirin and you're taking other types of medications, you mentioned one earlier before we started, it's ibuprofen or things like naproxen, or there's numerous prescription forms of these medications. They're called NSAIDs, non-steroidal anti-inflammatory drugs. Then your risk for bleeding goes up immensely. And it's not just bleeding in the gut. We do talk about that quite a bit. Things like ulcers, so stomach ulcers and ulcers in the first part of the small intestine, the duodenum. And so you can see ulcers happen in those places, but there is a risk even for bleeding in the brain when you take aspirin therapy.
I was going to say the people who generally are taking these 81 milligram, they're doing it just basically because it it's not as strong, obviously, and it's to assist maybe with problems you might have in your arteries around the heart as well as and then the brain too because of the stroke threat.
Yeah, exactly. So a lot of people, if we're looking at the group of people that really probably need to be on daily aspirin therapy, so it's going to be the people that have a high risk of cardiovascular disease. So they have a strong family history of early heart attacks. That's one demographic, or people that have kind of what we call a metabolic syndrome. So it's a group of certain diseases, things like high cholesterol and high blood pressure and obesity and things like that, all put together. And those people, especially if they have a strong family history of things like strokes and heart attacks, are candidates. But the recommendation is really for individuals who are 50 plus.
We got to take a short break. You ever spill one of those bottles of 81 milligrams on the floor?
It'll take you a week to pick it up.
It takes a long time because they're tiny and they bounce all over the place. We've got more coming up with Jeremy Daly from Tripp Family Medicine, Bill Cutley too, on News Radio 1310 KLIX and News Radio 1310.com. We're at 40 and it's 8:40. Oh, I was just listening to that. The annual flu vaccine. It's going to be a busy, busy season for all of us. I haven't gotten one, Jeremy. I
Wait.
haven't gotten one since 1996.
Really?
Yeah. I'm thinking this year might be the year.
Yeah. Well, that's always the year for me.
You need it, though, because you've got people coming in who are suffering from it. You don't want to pick it up.
Right.
And you don't want to transfer it to anybody else.
Right.
We've got a caller with us, and I just wanted to point out, too, as well. Jeremy Daly is a physician assistant at Tripp Family Medicine in Twin Falls. It's coming up on 8:44. We're at 37 on Magic Valley this morning. Bill Colley handling the telephones on Better Health with Tripp Family Medicine. And caller, you're up next. You're on the air on KLIX.
Yes, on the aspirin, daily aspirin, I just read an article that if you're a little heavier, a large person, that you need to take more than 82 milligrams per day. And I was wondering if you could comment on that.
Okay. Yeah, that's a good question. And it really depends on why you're taking it. The recommendation, based on the research that's been done, no more than 100 milligrams of aspirin is considered a low dose therapy. So if it's more than that, then it's usually affecting you in different ways. So like the 325 milligram aspirin, for instance, that's taken for the pain benefit, it's not doing. You're getting more than you need, essentially. 100 milligrams is probably the most that you need, even if, let's say, you weigh a little bit more. You're still getting the same antiplatelet benefit. Just to that point, and I think that's a great question. I have a lot of patients ask me, well, I'm a big guy or I'm a bigger lady, and I have questions about my dose. Should I be on this dose? Because I have a friend that is this size and we're on the same dosage of medication. Is that appropriate? And the truth is, everyone metabolizes medications differently, depending on what your body has, as far as there's specific basically factors called cytochromes that your liver makes that helps to metabolize medicine. And some people are hyper metabolizers, and they could be people that are smaller. So they may require a higher dose of medicine to get the same benefit that someone that was maybe a little bit larger or weighed more than them did, just because of the way that they metabolize. And so it isn't always dependent on weight. We do dose medication in children based on weight, but in adults, that's not something that we really consider. But that is a great question.
Yeah, thank you for the call. We wanted to point out, too, the numbers 208-736-0300, 208-736-0300. I don't think, I've been out of high school since 1980. It's been a while, another century. But I can remember hearing stories in school, and we were talking sometimes health class, and maybe even heard it around the home about people overdosing on aspirin. I haven't heard of anybody overdosing on aspirin in many, many years. But I would still think that if people are concerned about doses, you got to be careful. You don't want to take too many.
Yeah, and typically if you're getting to the point where it's an overdose of aspirin, it's probably purposeful. When I worked in the emergency room in El Paso, we saw people come in who had overdosed on aspirin on a regular basis, and there's treatment for that. We use a medication called N-acetylcysteine, and that actually helps to reduce the risk that is associated with overdoses with aspirin therapy. But in terms of in terms of it being a scary thing, it is. I mean, you can have ulceration of the stomach really quickly. I mean, you can bleed all over. I mean, and not just the stomach because it is a platelet inhibitor. It can cause some problems.
So I remember hearing when I was younger that once you got to be like a teenager, if you were taking it as a pain reliever, for instance, don't take more than two. Two would be like a maximum, and you would, if you can get by with just one, take one, right?
Yeah. So in terms of taking, uh, more than one, yeah, it just depends on the person, but two is the max that I'd recommend, and it's going to be no more than every 6 to 8 hours when you're taking that dose of medicine. So you have to be really careful. So don't I for most people I say if you're taking or you feel like you need to take more, sometimes you have to alternate with things like Tylenol, which you know as soon as I said it, it sounded wrong, but the N-acetylcysteine is for Tylenol overdose. So anyway,
Well, hey, quick question. Let me to jump ship and move things off in another direction, but we heard that message from the health department about the flu shots. Are you seeing cases right now?
we've seen a couple cases of the flu, but really not much yet. So I mean we're recommending flu shots and we're definitely giving a lot of flu shots. But this year I haven't seen a whole lot yet.
But my guess is that that this is not one of those things that gradually builds. All of a sudden, you go from a couple a week, and then boom, it hits, and then you've got a bunch, right, all at
No,
once.
that is the typical flow, I would say. A lot of times it's just like the floodgates open up and everyone gets the flu at once. And just, kind of in that vein, I think the important thing with the flu is if we're going to treat it with antiviral medications, which they're available, and we will treat with antiviral medications, it has to be treated within the first 48 hours of symptoms starting.
In other
So,
words, you can't hold it off after you've picked it up.
right, right. So if you are wanting to get treatment for the flu, it's best to come in the first 48 hours.
Now, talking a little bit about that, your health insurance is going to help people out because your insurer likes the fact that you have some prevention because that saves money in the long run. When it comes to things like aspirin therapy, though, I was always, nobody covers your purchase of aspirin. It's not a prescription drug, at least that I found out. When I was, buying the 81 milligram, you pay for it out of your own pocket. And I'm not aware of anybody that has such a Cadillac healthcare plan that it would cover the cost of something like that.
Yeah, maybe not. And even if it doesn't, I mean, the cost of aspirin is really inexpensive.
Hmm.
So, it's one of the cheaper medications out there. You can get a bottle of probably 300 for less than $10. I mean, you're spending $10 for almost a year of medication.
And
Seems like.
does it, certain things, you buy certain things and you put them on the shelf. If they're there too long, they lose their effectiveness. Does
Right.
that happen as well?
Yeah, I mean, most medications have an expiration date of about a year. So if it's beyond the year, then there's no guarantee that that medication is going to be as effective or
And some you shouldn't even take after a year because, that I would assume that sometimes some of the effects that could happen after something was on the shelf for too long. I know some people you walk in and their medicine chest, obviously has some,
full of prescriptions that are not new.
right, some of them 2.5, 3 years old probably.
Yeah, I mean, I have patients all the time coming in. Oh, I had this prescription of amoxicillin from 5 years ago that I've been taking for a week, and infection's not getting better. And so, is it the lack of efficacy of the medicine, or is it just that it's not responding to the amoxicillin because it's something else? It's hard to know. But yeah, I mean, you shouldn't be taking medicine that's more than a year old in most cases.
Now, if someone has already had heart issues, they may have already had a heart attack or they've had bypass surgery or something like that. Would you continue aspirin therapy, or is that a point where you start to say maybe this is too much?
Well, it just depends. Some people we continue aspirin therapy on. Some people they're on medications that are uh, a little bit heavier, things like Xarelto and Pradaxa and Eliquis and things like that. And those are prescription, a little bit more expensive type medications, but they're very effective. So we do recommend that. It just depends on the case. So it's one of those that over the air, I don't give any blanket statements. Don't just take aspirin because you think you might fit into this category. The best recommendation is talk to your doctor and say, should I be taking aspirin? The point of this radio show, I think, for as far as bringing this up, was you shouldn't be taking aspirin just because. If you're taking aspirin just because, maybe you need to talk to your doctor to see if you're a candidate for aspirin, if it would be a safe thing for you to take, if there's any reasons why any of the other medications you may be taking are going to interact with the aspirin therapy. Now, one of the last points I wanted to make was in terms of, aspirin having benefits long term. There are some studies that show people that have history of colon cancer, if they take it for long periods of time, meaning years, it can reduce their risk for developing colon cancer.
Why is that?
And that's the good question. So the studies that I was reading, they don't really know why. They're not sure what the mechanism is as far as the reduction of the risk. They're just finding that this is a correlative finding in the studies that they're doing on long-term aspirin therapy, that they're seeing. Well, if we're going to look at it in the big picture, a little graph here that actually kind of helps to see what the benefit is overall. So in 1,000 people, the amount of fewer cancers that they're seeing it's about 6 less cancers in 1,000 individuals who are taking aspirin therapy. So, is that significant reduction? I wouldn't say it's significant.
If you're one of the 6, it is.
Oh yeah, I mean, if that's you, that's 100% reduction, right? But overall, is it worth it? It just depends on the case. So I think, like I said, the biggest thing is what kind of cancer is it? It's not a general indication for reduction of cancer. It's just found that in some cancers it can reduce the risk long term. Now, in terms of how many fewer deaths do we see with people who take aspirin therapy? In 1,000 people, 5 people in 1,000 we see reduced death because of aspirin therapy. As far as fewer heart attacks, that's probably the biggest in terms of out of the 1,000, about 17 fewer per 1,000. So that's a pretty significant reduction. The other consideration is, well, how much more bleeding risk is there? About 16 in 1,000. So as far as almost equal as far as how much risk we see versus how much benefit. Depending on how severe the bleed is, it could be minor. But
you're working then with people almost on an individual case-by-case basis when they come through on this.
Oh, exactly. And I think that's the take-home message is there's not any blanket statement for medicine most of the time. We're saying, and I can't even blanket statement that. So we're saying it just depends on your case. It depends on your history. It depends on what you're taking. It depends on why you'd be taking it. And so with aspirin, it's wise to consider all of those options before you just say, I'm going to take this over-the-counter medication. And people, they look at over-the-counter medications as generally safe. And for the most part, that is true. But there are a lot of people that come in. I can think of a couple of cases where I've had patients that are very, very sick, lose a lot of blood, end up in the hospital, things like kidney failure because of overdose or overuse, I should say. Just maybe not inappropriate dosages, but duration-wise, inappropriate length of duration of these medications can land them in the hospital for bleeding ulcers and things like that.
A friend I used to work with, I know his father 20 years ago was about 70-ish, was taking an 81 milligram every day. I don't think anyone ever advised him to do it, and he was doing it. The man is now in his mid-90s. Up until a couple of years ago, he was still walking to his local Legion Hall, drinking 5, 6, 7 beers and smoking a couple of cigars every day, and then walking back home and getting up the next day and going about his business. I think he's 94 now, but I don't think the aspirin had anything to do with that ability that he could pull those things off. That's got to be genetics.
I would say so too. I mean, we see a lot of cases like that where, let's talk about guys like George Burns, for instance, right?
Yeah.
Drink and smoke for a long time and lived a long life. But, you look at most people that live that way and it affects them pretty negatively. I mean, a lot of patients who they age really prematurely due to overconsumption of alcohol and use of things like tobacco.
Yeah, I was going to say, that we sometimes tend to forget that there are some people who are just blessed with really good genes. In fact, my friend had an uncle who lived to be 107, but he also walked everywhere. He never owned a car, and that may have also been part of it, just that constant movement.
Right. Yeah. I mean, there's definitely a lot of factors to consider when it comes to things like that. But I think the take-home message is you make sure that you're making decisions based on medical facts. We there's no way to know when you're going to go and how you're going to go. But if we can reduce risk, if we can do things that would put you in a position that would help you to possibly be in a better situation, let's try and do that.
Got about 30 seconds to go. Again, Peel Party scheduled for this afternoon, and there may still be some available slots.
Exactly. So give us a call if you'd like to be there later today, and get a hold of us at 933-4400 and come and see us. We're taking new patients. We're happy to get to know you. We try to make sure we take care of people. We like our patients. So
I was going to say, the people I talk to who go to the office all seem to like you too. So there's a good working relationship back and forth with the staff at Tripp Family Medicine. It's not quite like an assembly line outfit. It's a good thing. I want to thank Jeremy Daly, a physician assistant from Tripp Family Medicine, for joining us this morning on News Radio 1310 KLIX and newsradio1310.com. We're at 37 at 8:59.